Insomnia is characterized by challenges in initiating sleep, maintaining sleep, or waking up prematurely in the morning with an inability to return to slumber. Individuals experiencing insomnia often receive insufficient or poor quality sleep, despite having ample opportunity for rest. This inadequate sleep can impair daytime functioning. It's important to note that insomnia is not determined by the quantity of hours slept, as sleep needs vary among individuals. Common symptoms of insomnia include difficulty falling asleep and/or staying asleep, variable sleep, such as several nights of poor sleep followed by a night of better sleep, daytime fatigue or sleepiness, forgetfulness, difficulty concentrating, irritability, reduced motivation or energy, making errors or having accidents more often than usual, ongoing worry about sleep. Many people with insomnia also struggle with depression and/or anxiety. Short-term insomnia, which typically lasts for less than 3 months, is commonly linked to stress. Examples of stressful situations that can trigger short-term insomnia include alterations in the sleep environment, like changes in temperature, light, or noise. Experiencing significant losses such as the death of a loved one, divorce, or job loss, recent illness, surgery, or the onset of physical discomfort. The use or withdrawal of stimulants, such as caffeine, specific medications, or alcohol. Short-term insomnia often improves when the underlying stressor is resolved or addressed. Situations that disrupt your normal sleep cycle, such as traveling between time zones, jet lag, and working night shifts, can also cause short-term insomnia. Long-term insomnia, also known as chronic insomnia, persists for more than 3 months, occurring on at least 3 nights each week. Chronic insomnia is associated with an elevated risk of developing significant medical issues. Chronic insomnia often coexists with other conditions, including mental health disorders like depression, anxiety, including panic attacks, and post-traumatic stress disorder, PTSD. Medical conditions such as respiratory disorders, high blood pressure, diabetes, and ailments causing pain, stress, or restricted movement. Neurological disorders like Parkinson's disease and Alzheimer's disease. Other sleep disorders such as sleep apnea, restless legs syndrome, periodic limb movements, and circadian rhythm disorders. Factors such as medications, caffeine, alcohol, over-the-counter remedies like allergy medications or nasal decongestants, or illicit drug use, irregular sleep patterns. When seeking assistance for insomnia, your healthcare provider will typically begin by inquiring about your sleep duration and any sleep-related issues you've encountered during a typical 24-hour period. You may also be requested to maintain a daily sleep diary, which involves recording your sleep patterns for 1 to 2 weeks. Diagnostic assessments may involve the following: polysomnography. This formal sleep study is conducted in a specialized sleep laboratory. It's a non-invasive procedure that employs sensors attached to your body to record data such as movement, brain activity, breathing, and other physiological functions. Actigraphy. Actigraphy involves monitoring your activity and movements using a device similar to a wristwatch. This device is worn throughout the day and night. Cognitive behavioral therapy for insomnia, CBTY, is a recommended primary treatment for individuals struggling with insomnia. It focuses on addressing negative thought patterns and behaviors that interfere with sleep, and this is usually sufficient in improving insomnia, although in some cases, medication is recommended as well. CBTY employs various strategies, including stimulus control therapy. This method helps break the cycle of sleep resistance. It involves establishing a consistent bedtime and wake-up time, avoiding daytime naps, reserving the bed for sleep and sex only, and leaving the bedroom if you can't sleep within 20 minutes, returning only when drowsy. Relaxation techniques. Techniques such as progressive muscle relaxation, biofeedback, and breathing exercises are used to reduce pre-sleep anxiety. Sleep restriction. This therapy limits spent in bed, leading to partial sleep deprivation and increased tiredness the following night. As sleep improves, bedtime is gradually extended. Passively staying awake. This approach aims to reduce anxiety about falling asleep. It involves trying to stay awake in bed instead of anxiously waiting to fall asleep. Light therapy. If you have a tendency to fall asleep and wake up too early, light therapy can help adjust your internal clock. You can either spend time outdoors during daylight hours or use a light box during seasons with limited natural light. Consult your healthcare provider for personalized recommendations. Over-the-counter sleep aids are readily available for adults to purchase in stores. Typically, these products contain antihistamines, which are primarily used to treat allergies but can also induce sleepy. Melatonin supplements are another option some individuals use to improve their sleep. Melatonin is a natural hormone produced by the body that helps regulate sleep. However, it is essential to consult with a healthcare professional before considering these sleep aids. Non-prescription sleep medications, which often contain antihistamines, are designed for occasional use and not for regular, long-term consumption. Talk to your doctor before you take these, as antihistamines may cause side effects such as daytime sleepiness, dizziness, confusion, cognitive decline, and difficulty urinating, which may be worse in older adults. Prescription sleeping pills are more potent than over-the-counter options and require a doctor's prescription. These medications fall into categories like antidepressants, benzodiazepines, and Z-drugs. It's crucial to consult with a healthcare provider about these medications, as they can lead to daytime drowsiness, an increased risk of falls, or even the development of dependence. If you are pregnant or breastfeeding, any medication you take can affect your baby. Always consult with your healthcare provider before using over-the-counter sleep aids or supplements during this time. It's important to note that giving over-the-counter antihistamines to children to aid sleep is not recommended, as these medications are not intended for this purpose and carry a risk of overdose. Likewise, it's best to avoid giving children supplements like melatonin, as their safety in children has not been thoroughly studied.